You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Well, good morning, everyone. What a world we live in. I mean, if you'd have told me a couple of weeks ago that I would look forward to going to a grocery store, I would have called you crazy. This is craziness. Wow, the world upside down in a couple of weeks. Good to have you on with us this morning. We're going to answer some questions. So guys, good morning to you. Let me go over a couple of questions that were asked and a couple of new studies that came out. One was on, see, I'm not supposed to touch my nose. I forgot. Well, you know what? Let me answer one question. Somebody was asking me, what's the best way to, not best way to wash your hands, but what do you use to wash your hands? Well, let me just tell you, soap and water are the best. Now look, people are using, baby wipes and, the hand sanitizers and all that. Look, we live in a crazy world and it's better to be safe than sorry. But let me just say, look, if we're going to make this, which we should, by the way, a habit, to wash our hands more frequently. But remember something, okay? Part of your immune system is bacteria. There's good guys and there's bad guys. I talked about this. Why everybody in the universe should be on probiotics. It's not a question anymore. Guys, everybody needs probiotics, but your body, even on your skin, has an army of good bacteria. They're good guys. That's why I tell people, go out and play in the dirt. Go play in the dirt. That's why gardening is so good for you. And I know a lot of you wear gloves, but get in the dirt. Get some dirt under those fingernails. Why is that? Because there's good bacteria. You need good bacteria. Look, you can't strip away. If you strip away, like I know, wash your counters and all these things, but guys, listen. The coronavirus, the COVID-19, if you have no immune system, I don't care how many times you clean. I don't care how many times you wash your hands. Because and I know they're talking about it a little bit, but not very much. People are you dying with COVID-19? And listen, I'm not minimizing that. It's a terrible tragedy. But are they dying with COVID-19 or from COVID-19? The vast majority of people that get COVID-19, look, we might all get it, but whether we get sick from it and really sick is dependent on your immune system. It's the host. It's not the virus, it's the host. Nobody's talking about that. Like Dr. Fauci or whatever you say his name is, he never mentions it once. Everything, he wants to close the whole world down. He can't believe that there's any city in the United States that's not completely on shutdown right now. Okay, that's his opinion. But here's what Dr. Martin says. Okay, shut down forever? Forever? I read an article this morning that one fourth of all small businesses are going to be closed in the next few months. They're just never going to start up again. Guys, I don't know if we're thinking about these things, but I know the virus. I get it. And that might be our new reality forever now. Because COVID-19 is going to become COVID-20, meaning that it will raise its ugly head again. And what I'm trying to teach is, you guys, be ready. Your immune system, because we're not always going to be able to socially isolate ourselves and distancing. And come on, is this going to be in 2 years from now, there's not a restaurant open, that you got to go into a grocery store one at a time and 6 feet apart forever? Come on. We live in a world where there's what, 7 billion people on the planet? Where is that going to happen? Yeah, oh, I live in Alaska. Well, good for you. I mean, what are we going to do? All go live in, well, if we all go live in Alaska, we're not going to be able to practice that either. I mean, what are we going to do? We live in a world. We're near each other. We don't all live on a farm. We can't. True or false? So all I'm saying is, guys, don't come after me, okay? Please. Oh, Dr. Martin is in denial. He's in denial. And no, I'm not in denial. The government told me to stay home for 14 days after I got home from Florida. And guess what? I did it. I'm just glad they didn't tell me I couldn't go. Some people are suggesting we shouldn't even go for a walk. What? The best thing you can do is exercise during a virus like this, vitamin E. So the best thing to do is wash your hands with soap and water. And don't use too many chemical or alcohol-based hand sanitizer. You're stripping away your good guys. And okay, for a week or two, I get it. People are going crazy with, there's no more baby wipes and all that. Those are alcohol. I use them in the office for my hands in between patients. But I take probiotics all the time to replace that. Because I can't go run to a sink and wash my hands with soap and water, for years, right? And I would put gloves on anyways. I always had gloves on with my patients. But guys, listen, we live in a world, you have to understand what I'm saying. This might be our new reality. COVID-19, COVID-20, COVID-21. Because now, every time it happens, we're going to go, like the world's going to shut down maybe again. Or maybe we'll never open up again. I don't know. Don't ask Dr. Martin for my predictions because I don't know. Like if you'd have told me a couple of weeks ago, I was in Florida when all this was happening. I was there when they closed Disneyland and when they closed the beach. Like I said, I felt like, well, I did tell a lot of people, I thought that wasn't a good thing to do. I get it with the social distancing, but we should all be on the beach. The best place. Sun, vitamin D, get outside. If you can't go for a walk, get outside. Look at least in Sudbury, you can see it behind me. The sun is out this morning. Guess where I'm going right after this? For a walk. I kind of got a chuckle last night. My wife and I went for a walk and a guy saw us coming down the street. And it was almost like I had the bubonic plague or something. Like he headed for, he didn't go 2 meters? 6 feet? He went 100 meters away from me. He would have gone one way, he'd have got killed in traffic. But he went the other way as far as he could from me. He left the sidewalk and went into the ditch. Is that craziness or what? Anyway, wash your hands, soap and water, if you can, if it's available to you. Try and be careful with these alcohol-based and chemicals putting on your skin to strip away, because they strip away all the bacteria, including your good guys, where soap and water is not near as bad for your good guys. Keeps the good guys. You know what's a good thing? Get oil of oregano spray or put a couple of drops in the water. That's tremendous. Tremendous, because it don't kill your good guys. Just the bad guys. See, nature knows how to get rid of bad guys and keep your good guys. Nature. Yeah. That's why soap and water is much better. okay, than the alcohol-based or the chemical-based ones, stripping away your bacteria. I know you haven't heard that, but that's why I wanted to bring it to you. I look at things a little bit differently, and that's my job, by the way. I feel it's my job, okay? So, a lady was asking a question this morning about what supplements should you take? Well, look, here's what I took this morning. Probiotic, vitamin D, and soon enough, I hope, I won't have to take D or as much D because of the sun. The sun. Go and sunbathe today. If it gets warm enough, make sure your arms, you see, your arms is where you get, and your legs. It may be a little early for shorts, for most of us in Canada at least, most of us. But if you can go short sleeve, 20 minutes, you get 10,000 IUs. And make sure your eyes get vitamin D too. Don't put the sunglasses on right away. Okay? Don't wear sunglasses, right? Your eyes need vitamin D for them to be healthy. So don't put I'm not against sunglasses. Don't say I am. I'm telling you, let some sun get in there first and then put some sunglasses on. Okay. So we talked about hand washing, touching my beard. Another question was last week. Oh, somebody asked me last week. I didn't get to it last week. Okay. Let me just look at it. Oh, this lady, what was her name again? Oh, Michelle. Okay, Michelle, very good question. She was at a iridologist. That's looking into the eye, okay? I took that course in the probably 72, iridology. And I don't remember anything because I've never practiced it, okay? And she was asking, well, an iridologist said something about looked in the eye, saw inflammation or whatever. Look, good for them. It's not my expertise, so I'm not going to talk about it too much. But I did want to make one point because, the iridologist 20 years ago said something. Well, good for them. But remember something. You're fearfully and wonderfully made, right? You get a brand new blood every 4 months. Brand new blood. You make your red blood cells every 4 months. You give it all brand new. Every one of them is brand new. So what happened years ago doesn't have to be true today. Because I always tell people, look, there's genetics in life. I look like my dad, honestly. I do, okay? I look like my dad. They didn't call me Tony Jr. for nothing. Now, thank God Tony Jr., my son, doesn't look like me. He looks like his mother. That's where he got his good looks, okay? All I'm saying is, look, genetics are genetics. I understand that. But when it comes to disease, genetics is less than 5%. Oh, my mother had breast cancer. So what? Why do you have to get it? Right? My father had heart disease. So what? Why do you have to get it? You can override your genetics because you get brand new blood. You get brand new cells. You get a brand new body. Your body is always making bone cells, heart cells, gut cells, muscle cells, everything. You get brand new, and you can get right to the DNA. You can get right to the mitochondria within those cells with good nutrition. Yes. This is why I talk about the reset all the time. A 30-day metabolic change. Proven. 100%. Tony Jr. even had a slide yesterday showing that even if you don't lose weight, let's say that happens, and some women, you know how women, you're from men are from another planet, okay? But ladies, not always easy for women to lose weight. There's a lot of factors. There's hormones, okay? A lot of women don't have hormones. They have hormones. I'm making up a t-shirt with that. Hormone. And you know what? They're not losing weight and they're frustrated because they get on the scale and but I'm telling you, if you do the reset, If you cut out your carbs and cut out your sugars, big things are happening inside of your body. Big things are happening inside of your brain. Big things are happening inside of your liver. You're completely emptying out your liver, elevating your glutathione and everything. I'm telling you, thousands of people have fixed their blood pressure in 4 weeks. Thousands of people are no longer diabetics in 4 weeks. They were diabetic or pre. Their A1C was over 5.7, and some of them were over 6.5, and well into the 7s, diabetes. And they fixed it. Some of them can't get over it. And even some doctors had to admit, like I had one tell me the other day, I don't know how you did it, but I can't argue with it. The results are there. Yeah. Non-alcoholic fatty liver gone. 4 weeks. You want to know why I'm excited and passionate? Oh, Dr. Martin, it's so hard. I didn't say it was easy. How easy is it to give up your carbs when you're a carbaholic? Not easy, but it's simple. No carbs for 4 weeks. None. Nada. Hey, it works. I had a lady online the other day said, I can't do it. I can't give up my fruit. Well, what can I tell you? If you can't give up your fruit for 4 weeks, I don't know what to tell you. It's not for you. It's all right. I still love you. I love you anyways. I do. I can tell when people come to see me in the office, I can tell within 5 seconds if they're buying it or not. Hey, I can't go home with you. If you don't want to change your diet, Dr. Martin can't help you because I can't go home with you, right? I can't. You got to do it. That's why I know I'm preaching to you guys. You guys have done this. Most of you know exactly what I'm talking about because you made lifestyle changes. Good for you. Here's what I took for my vitamins this morning. Vitamin C, coffee. You know what I was saying? I think I said it yesterday. Vitamin C on its own. Like I'm talking about the real vitamin C. You know, when you get it, you get that in an orange or a grapefruit or fruit, right? Vitamin C. I'm not against it, by the way. So don't get me wrong. I'm just saying that a new study came out on vitamin C, Dr. Martin's vitamin C. Coffee this morning. Let me read it to you. Coffee is one of the greatest antioxidants and anti-aging coffee. Better than vitamin C. The only problem with vitamin C is when you use it on its own because it doesn't stay in your body very long. It's not very bioavailable. And the problem with that is unless you're taking massive doses, I like it with COVID-19 because they're showing in hospitals in China and a few in the United States. I don't know if there's any in Canada using it. But vitamin C is very good intravenous, giving multiple grams of it in intravenous. I like that. I like IV therapy for vitamin C. But I like coffee. It's so good for you. I told you. I've been saying this for so. If you said coffee was good for you in the 1980s, they used to attack you. That's not good for you, Dr. Martin. You should hear what I used to hear. That's acidic. It's acidic. Coffee's acidic. No, it's not. Because when you drink coffee, your body has sodium bicarbonate to make it alkaline.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.